We all heard the term menopause, but what is perimenopause? Perimenopause is the period of a woman's life when she starts experiencing just the first subtle changes in her hormonal levels. And that period can last anywhere between a couple of years and up to 10 years, and ultimately leading to the menopause, the time when she stops having period. So how can you notice that you're starting this perimenopausal period? You can notice the changes to your cycles. They might get longer, they might get lighter, or the period just don't come at the same time as they used to. You might notice occasional hot flashes or waking up sweating. Some women start experiencing the vaginal dryness and pain with sexual activity. One of the most common symptoms that I hear from the women is feeling moody, not having enough patience. They feel like their depression gets out of control, they feel more anxious. And also it comes with inability to concentrate. They start experiencing this occasional brain fog where they just can't remember one or two words. The productivity might decline. And because changes happen so subtle, it might be difficult to diagnose and recognize that perimenopause is what's responsible for all those symptoms. So how can you diagnose and establish that that's what's happening? Well, you can do the blood work. The best time to run the blood work is between day 3 and 10 of your menstrual cycle. That's the time when we expect women to have certain levels of hormones depending on where in life they are. If you do the blood work on other days of your cycle, it can be more difficult because in period of menopause, your hormones just all over the place. There are certain values that we'll look at when we look at your blood work. For example, one of the strong predictor of you being in a perimenopause, it's rises in follicle stimulating hormones, or FSH for short. We can also look at the level of your estrogen, at the level of your testosterone. And sometimes decreasing levels of testosterone actually responsible for a lot of your symptoms. So what can you do to help that transition, that perimenopause period, to go as smoothly as possible? So maintaining the healthy lifestyle is the first step. Make sure you have a proper nutrition, get enough rest, and do weight-bearing exercise. Or you can treat it symptomatically. For example, decrease the temperature in your room, or use a fan if you're experiencing hot flashes, or use the moisturizers if you experience vaginal dryness. But the best treatment option would be the hormone replacement therapy. Replace the hormones that are being lost. What's interesting, depending on your symptoms, you might have estrogen predominant symptoms, or you can have testosterone predominant symptoms. And you can start using either one of those hormones, or sometimes you can start using both of them at the same time. In the past, there was a notion that you need to wait until you stop having your periods for the whole 12 months to officially be postmenopausal, and then you're allowed to take the hormone replacement therapy. Well, that's not true anymore. If your symptoms are severe and it's affecting your quality of life, you can definitely start hormone replacement therapy. When we start hormone replacement therapy, we start with a very small dose and titrate it up until you start feeling good and well at your optimal health. We do check labs periodically just to make sure that you absorb the medications appropriately and all other values stay in check. But again, because you're perimenopausal, your hormone levels can fluctuate. So that's why we're guiding the treatment by your symptoms and less by your labs. Perimenopause can have a lot of symptoms, but some women might just have one or two. Some women might experience only vaginal symptoms of vaginal dryness, discomfort with sexual activity, or start noticing some changes to the urination, like pee more frequently or urgently. If they don't have systemic symptoms, it's totally normal to replete the hormones only vaginally. Vaginal estrogen do not provide all the benefits of systemic hormone replacement therapy, but it improves the quality of the vaginal tissue, improves lubrication, helps to maintain the healthy pH and microbiome, also preventing women from having urinary tract infections. And some women might start experiencing both systemic symptoms and local symptoms. And in those cases, it's totally appropriate to supplement with both systemic hormones and vaginal estrogen. When you add vaginal estrogen, you do not need to redose your systemic hormones because vaginal estrogen is the local treatment. It just adds an extra boost to the areas that needs it most. Another treatment option that you might have heard about is some women choose to take the antidepressants. Well, it can help with mood, improve depression and anxiety. However, it does not address the main cause of all the symptoms. And it's actually known that the women who start using hormone replacement therapy notice that their depression and their anxiety and their mood disorders significantly improve with time. And the question that I commonly being asked is when to stop hormone replacement therapy. It used to be believed that you should stop hormone replacement therapy at the age of 65. Well, studies now shown that you don't really need to stop it and you can take it indefinitely. Because while you're taking your hormone replacement therapy, you also prevent cardiovascular condition, prevent your bone loss, and also it helps you to stay youthful as long as possible. So where can you find help? So in addition to talking to your doctor, there are also resources that are available to help you navigate your perimenopausal journey. One of the good resources is Menopause Society of North America. They actually have a list of all the providers who are certified menopausal providers, and you can find the office phone number and reach out and set up a consultation. And a lot of them also do telehealth, so it should be very accessible for you whenever you are. Perimenopause can be a very challenging period of women's life, but it should not be. If you start noticing any non-specific changes and symptoms, make sure to talk to your doctor or find a medical provider that's listed on the Menopausal Society of North America and talk to them and see if hormone replacement therapy is right for you.